You know, for pretty much all of history, surgery meant one thing: getting cut wide open. But over the last few decades, a quiet revolution has totally changed the operating room. So, how is this even possible? Let's dive in and unlock the secrets behind the technology that's making surgery less of an ordeal and more of a modern miracle.
I mean, just look at the difference here. On one side, you've got traditional open surgery, the big incision, that long, painful recovery, and of course, the major scarring we all imagine. And then on the other side, minimally invasive surgery. We're talking tiny incisions, a super fast recovery, and barely a scar. And this isn't just about appearances, it's a complete game changer for the patient, turning weeks of downtime into just a few days.
So, what does this actually mean for you, the patient? Well, it means way less pain after the operation and a much shorter hospital stay. It means less blood loss, which is a huge deal for your body. And because you're not wide open, there's a much lower risk of infection. It all adds up to one thing: getting you back on your feet and back to your life in a tiny fraction of the time. But how on earth do they do it? Well, it all comes down to solving three huge challenges.
All right, first up, the vision challenge. Think about it. If you're not opening someone up, how in the world do you see what you're doing?
It's the most basic problem there is, right? You just can't operate on something you can't see. So how do surgeons get this perfect, brightly lit, high-definition view of your insides, all through a tiny little hole?
Well, the answer is this incredible piece of tech, the endoscope. It's basically the surgeon's eyes. It's like giving them a tiny camera on the end of a wand, sending back a magnified, crystal-clear picture of everything they need to see right there on a screen.
And the real magic is what's packed inside. If you look at this cross-section, you can see the genius at work. It's not just some hollow tube. There's a whole system of tiny rod lenses that transmit that super clear image. At the same time, you have these bundles of fiber optics that are piping in bright, cool light, lighting everything up inside without generating any dangerous heat. It's an amazing solution that gives them both light and sound.
Okay, so we've got sight covered, but that brings us to the next big problem. How do you get your tools in there to actually do the surgery? This is the access challenge.
The key to this keyhole idea is an amazing little device called a trocar. The best way to think of it is as a secure gateway, or a port. It creates a stable little tunnel through the body wall so the surgeon can pass instruments in and out. And this is critical. It has a special valve to make sure none of the internal pressure they need to work is lost.
So, how does it work? Well, a trocar basically has two parts. You've got the outer hollow tube, that's called the cannula. That's the part that stays in place and forms the port. Then there's a sharp inner part called the obturator, which is used to make that initial tiny opening. As soon as the port is in place, the obturator comes out and you're left with a perfect little working channel.
And the whole procedure is it's so simple and logical when you break it down. First, the surgeon makes a tiny cut. Next, the area is gently inflated with gas, and we'll get to why in just a second. Then the trocar goes in to create that working port. And bam, you've got a sealed, stable entryway for all the long, specialized tools the surgeon needs to get the job done.
And this is where it all comes together. See, a surgeon doesn't just use one of these things. They'll set up a whole array of them, creating several ports. This lets them put the camera through one, a grasper through another, a cutting tool through a third. It gives them all the different angles they need to work, almost like their own hands were right there inside.
Okay, so we can see inside, and we can get our tools inside. We're all set, right? Well, not quite. There's one last huge problem. The inside of your body is, well, it's really crowded. And that brings us to the space challenge.
So, check this out. This is what the inside of your abdomen normally looks like. The abdominal wall is sitting right on top of all your organs. There's literally zero space. It's impossible to see anything clearly, let alone operate safely. Trying to work in there would be like trying to build a ship in a bottle from outside the bottle.
And here is the absolutely brilliant solution. Surgeons use a gentle, controlled flow of carbon dioxide gas to inflate the abdomen. It literally lifts the abdominal wall up and away from the organs, just like you're pitching a tent. This technique creates a pneumoperitoneum, this big, clear dome of space for the surgical team to work in safely. It's such a simple idea, but the result is a total game changer.
Now, using gas is probably the most common way to do this, but it's not the only trick up their sleeve. For some surgeries, they can create space in other clever ways, like using a tiny balloon to separate layers of tissue, or using a sterile fluid to expand a space, like a joint.
So,
Vision, access, and space. By solving those three core challenges, surgeons have ticked off a whole new era. It means incredibly complex operations can now be done through tiny little holes, completely changing recovery for patients in dozens of different specialties. And the result is exactly what we saw at the start: less pain, less scarring, and a much, much faster trip back to your normal life.
And this isn't some niche, futuristic thing anymore. As the experts say, this is the direction modern surgery is heading. For countless procedures, this has already become the new standard, and they're finding new ways to use it every single day.
So think about it. We've gone from these huge, open incisions to working through tiny little keyholes. It just makes you wonder, what's next? As this technology keeps getting better and better, what happens when the surgery shrinks so much that it becomes almost invisible?